Perfect. All right. Good afternoon, everybody. Thank you so much for joining us on our exciting panel for today. We will be discussing big data and health informatics with these amazing panelists. So I will actually pass the camera forward to each one of them so that you can get to know them better. I'll start with the top left with Dr. Noor Al Mheiri, who works with Emirates Health Services. Would you please let us know a little bit more about you?
Hello, good afternoon, everybody. This is Dr. Noor Al Mheiri. I'm a consultant family physician and director of mental health department and visiting consultant program here in Emirates Health Services. I was working also as a head of policies and standards in the hospital departments, and part of that was analyzing our patient outcomes and the clinical outcomes within the health services in the hospitals. Nice to meet you all.
Great. Welcome, Dr. Noor. It's amazing to have you with us. And we also have Sajjad Kamal. Would you like to introduce yourself?
Sure. Well, thank you, Aya and the team. Exciting conversation ahead. So I'm Sajjad, and so I guess the first identity I hold is I like building technology. And pretty early on in my life, I feel incredibly grateful where I had an internship where I was actually asked to look how technology improves people's lives. And for me, I accidentally stumbled upon healthcare, which is elementary and made more popular these days with the pandemic that we're going through. And this was a time where the internet was not widespread, and I was looking into doing telemedicine without the internet. So you can already imagine the challenges. So I like using technology to solve healthcare challenges. So fast forward many years, I looked into a different data set, starting off in Dubai, in fact, which was health insurance claims data and understanding people's health insurance claims and chronic conditions and being able to help put them into context. So as an entrepreneur, I built that product, sold that company. It's called Benepol. And then I was on to my next thing, again, on the healthcare technology side. So always looking for technology to be applied in healthcare. Built a company called Alam Health, which was looking into providing data insights on radiology imaging. So first connecting different radiologists from different locations. And then in addition to that, it's how you can use algorithms to be able to analyze medical imaging data. About 2 years ago, I stepped down. So these days I work as a venture capitalist at Global Ventures, where I oversee their HealthTech practice. And I do other consulting practices on the side. And coincidentally, it also aligns in the data field and healthcare data field. So I've done consulting projects around helping public sector facilities and mobilizing their healthcare resources through COVID. So this is a space I feel really passionate about, and incredibly grateful to be part of the conversation today.
Great. Welcome, Sajjad. And we'd love to hear more about the startups that you've come across in healthcare. I'm sure we're going to find those extremely inspiring. And one of my favorite startups, who actually has entered healthcare as well, is Thea Mhyrvold. But I'll let her introduce herself as well. Welcome, Thea.
Thank you, Aya. Lovely to be here today and looking forward to the conversation. I'm Thea. I'm a serial entrepreneur. I built different ventures in education, healthcare, wellness, and retail. So very excited to be here today. And very similar to your story, I really love how technology can be used to really scale impact across different sectors and look at technology about really connecting people through technology and not replacing people with technology. That's always been my personal thesis. We also went on to build one of the first sort of TRA and telehealth approved applications here in the UAE, which we launched during Arab Health. So have a lot of experience in this space. And we're also doing a lot now around wellness, mental health, and done some very nice CSR projects in partnership with Expo and Expo Live. That's also been featured during the Expo 2020 as well. So happy to share some stories about how we've also seen things happening in other parts of the world, Latin America being one of them, and how we can apply that learning across as well.
Amazing. I'm really excited for this. Being a moderator, I get to learn a little bit more about any industry that I'm talking about. So this was actually very informative. Thank you, Sajjad, actually in advance. He has gathered a lot of great insights before this talk, which I have looked through. Happy to share it with you guys, of course. I of course became very curious about this concept of big data. I mean, we talk about big data across different industries, and health informatics for me was a completely new subject. So this was also very interesting to learn about. But let's tackle each at a time. So I'd love to go into big data and discuss, what is the effectiveness? What does this mean to the healthcare industry? And actually, I'll ask Sajjad to start. Maybe you can summarize it for me in what I posed on LinkedIn as the question of the 5 V's of big data. So could you maybe break these down for us?
Sure. So look, I mean, healthcare data comes in various forms, right? And maybe the first V, but and the velocity it's coming at is increasing really, really rapidly. We've got all these wearables we're wearing. We've got, and to Dr. Noor's area now, there are some great advancements made in being able to track emotions. So you'll possibly have a mental health wearable soon. Now, that's just scratching the surface. What happens with all of this data and the high velocity of data that starts to come in is what you can ultimately do to uplift human lives. So this will get started. This will get, feeding into some of the telehealth applications that Thea and her team are working on. So the velocity is going to be great. The variety is going to be great. The volume is going to be great. Now, on the volume side, you'll start seeing aggregated pools of data that operators, hospital operators can start looking at and being able to come up with insights of what needs to be done. So, I mean, take a young mother who visits a hospital. They don't like waiting, right? Waiting, and literally when somebody is in pain, you don't want to be stuck in a waiting room to be told when your bed is going to be ready or when the doctor is going to be able to see you. So when you're literally in these vulnerable situations, you want good access to care. You want rapid, delivery. So data is going to enable you to be able to say, okay, we should have planned our bed occupancy a bit more effectively, or X number of staff needed to be on staff because we could see a pattern. We can see. So that's kind of at the macro level, and then going up all the way to the top. And I've had some great privilege working on some public sector data last year, which is looking at the entire landscape in one go, which is number of people with certain disease cohorts. Why are they checking into hospitals? Where is COVID dispersion happening, or broadly speaking, infection dispersion happening? How many beds do we need to build up? How many hospitals do we need to build up? So I think it's going to go from the little to the large. And on the little side, it'll like when I come into like the individual basis, we'll soon have data that's like live streaming from our bodies. What the glucose reading of post meal consumption is. So if you consume this juicy, warm, delicious chocolate cake, what's the impact of that on your body, right? So you've got this like really large invasive data set. Then clinicians, so you'll take your telehealth offering, and the data set's going to be there. And then when you show up at your clinician, they'll be able to see all of the interaction and be able to just get a better process. So that young mother who is in pain literally in that waiting room will hopefully and ideally have a better quality of life and better quality of health. So I'll pause there for a bit.
Yeah, and I can see Dr. Noor nodding away. I feel this is definitely something Emirates Health Services is looking at. I'd love you to comment on this point, actually.
Sure. I agree with Sajjad regarding big data. Actually, we do have, big data in terms of health, and many electronic systems feeding into that big data. But how much we are using from that big data, and how we can analyze it and put it back in the service. This is where we find still the challenge, and to use that big data in the right way. Actually, we started using big data in terms of monitoring our services, in terms of operational and clinical, and the feedback that comes later to the service and how we can improve the service. As Sajjad said, these KPI and outcome measures are benefiting our leaders and our hospital directors, and how to improve the service, where are the trends, where are the heat maps. We do have dashboards, live dashboards, and even dashboards that look at the service retrogradely, monthly and yearly, just to look at from different angle the patient journey in the ED, in emergency department, in the inpatient, outpatient services, critical care services, and where are the bottlenecks, how we can improve the whole patient journey, and the prediction in the emergency department, where are the heat maps, so I can even later utilize my resources and put the right resources at the right time. So that lady that Sajjad was talking about, she won't wait, because we are managing, we are seeing live and retrograde data, and based on that, we are improving our services. And maybe later through the discussions, I will give one case study about our program, PACE program, and how it started and what are the outcomes of that program.
No, that's fantastic, actually. And I think, Sajjad, you had even mentioned something about the PACE case study on the information he was gathering. So that's great. Actually, now we can get firsthand information on how this is working. Speaking of big data and some of let's say the strategic planning that we can improve just by having big data, I'd love to pass the question to Thea. Since you advise a lot of big companies like Shellhoop, just how we can actually utilize data. So I leave the floor for you.
Yeah, it's a great question, and that was my comment actually as well. I think a lot of when we talk about digital transformation and digital strategies, we always talk about data, but I think it's really important to ask the questions why and what are we looking for in this data. So data for the sake of data is just noise, but what are the success metrics? What are we actually trying to achieve? And then how can we analyze the data in the right way to make sure we're getting to those outcomes? And I think with big data, there is so much data that we can analyze, but it's really understanding the key sort of success metrics. I always ask people in this digital transformation journey, what does success look like for you? And I think that's really important to understand the foundations of what you want to do with this kind of data. And at the basis of that, then you can build proper strategies. Then you can really make sure you're analyzing the right data points to get those kind of outcomes that you're looking for, be it in predictive analytics or otherwise.
No, definitely. And to your point, as well as I move the question to Sajjad, you had mentioned waiting times for people coming in. I'd love to discuss the potential of, as well, the types of technology that would enable this. So are we talking about infrastructure changes? Are we talking about, is it going to be software related, hardware related? I'd love to discuss what you've been seeing as well, Sajjad, from your perspective.
Sure. So, I mean, I'll actually kind of loop it back to what Dr. Noor was saying, what Emirates Health Service is doing. I think you're already kind of in that journey to be able to integrate a lot of these insights and be able to generate from it. I'll still tie back to data, and then I'll talk about the different kind of technologies that are coming together. And something I just came across not too long ago was apparently in healthcare, and don't quote me on this because the study was done by somebody else. Only 3% of data is actually used, right? So of all of the data that we're generating, only 3% is used. To put it into context, like imagine that same young mother walking into the clinician's office and knowing that my diagnosis that I just got, only 3% of that data was used. Maybe the symptoms I've described to the clinician, my lab results that came out, my radiology exam results that came out, but in everything that was potentially collected, perhaps the heat map that went to the dashboard, perhaps the glucose readings that they've covered on their glucose devices at home, none of that was factored in, right? So, but to put it into context, like imagine the question that young lady would have is, am I getting the best quality care given that only 3% of data that I generated was actually being used to give me a diagnosis? I don't think the patient would be too happy. Now, that being said, they are getting really good quality care. I think we have amazing care, in Dubai and beyond. But when you look at the evolution of this, imagine being able to start unlocking more and more of that 97% of data. So this is where technology will start converging. Every step in your home, everything you eat, everywhere you go could possibly be factored in. The air you're breathing, who you're interacting with, your emotional state. Imagine being able to feed that data somewhere and be useful when it comes to clinical care delivery. So I think this is where technology is really going to start converging. Today, we're really scratching the surface of what our Apple health devices are generating. Just open up your Apple Health app and it'll tell you about your sleep quality. It'll tell you about your heart rate variations, what time of the day, who, what time, what place makes you feel better. So how much activity you have. So you can start generating all this data, but I think all start aggregating. Like soon we're gonna have elevated sensors at our home. Soon you're gonna have so the Holter monitor is a clinical device they use to test your, let's say, heart condition. But today it's an independent device that gets given out to hospitals and the data is probably just recorded on this device. And then when you come back to the hospital, that's when they read it. But imagine that being able to be live streamed and beamed, and then your cardiologist might spookily call in through your smart speaker and say, you know what, noticed an abnormal activity, and the doctor will see you now. So a lot of these enabling technologies will start coming through. We're seeing convergence of, the new buzzword, metaverse. What does that mean, right? So you might be able to, now we can mock about it. Oh, are we really going to spend time in this artificial world? But there are people, let's say, who could be suffering anxiety issues. And I was actually just talking to a team that's working on, they're out of Europe. They're working on an incredible application where they're using this virtual reality or metaverse application to calm people down before surgeries, right? It's imagine how much enabling a clinician would have or a surgeon would have when the patients are really calm. Sure, you can have a drug-based intervention, but just by spending a few minutes right before you're about to go into surgery in this alternate world where you're chasing butterflies and walking around the garden just to calm yourself down, right? So you're able to use the power of technology to uplift that person. And when they're calm, because you've completely transported them into an alternate reality, whereas you can't change this environment inside hospitals, right? It's busy, it's infection prone, you have to follow protocols, and you have to do a number of things. So just being able to provide these kind of technologies is helpful. So I think mixed reality, alternative reality is definitely a new enabling technology. And we see countless companies doing really, really, really interesting things in the space to make the world a better place. And then I think the third technology I want to talk about before I want to give the space to my fellow panelists is really what's happening in this whole decentralized data world, is the question around what happens to your data, who do you give access to, and the data ownership. So we're seeing new technologies come in where you're going to start owning your own data. And I think if I can boldly claim this, where very near in the future, very shortly, your smartphone is going to be the largest source of your healthcare data. You'll possibly have a copy of your data there's a replica of, let's say, the data that's in Malefi. You will have your wearables data that's feeding into it. You could be using an application that's helping you with your mental health condition, and the adherence, the usability of it's all stored on your data. And you as a human being will have a choice of whether you share that data, what you do with it, and what value a healthcare provider brings to you.
Yeah, I would love to ask now, Dr. Noor, what do you think? I mean, that's an interesting question between privacy and utility as well to the healthcare industry, right? So Thea works on this every day while advising clients on which direction to go in, and it's all based on you. So I would be so interested to actually know more. What do you think?
Actually, I believe it's a balance. I mean, so we give the patient the right to choose. This is your data. However, with your data, we can do good outcomes. We can do better health. actually, and even some of the examples that Mr. Sajjad already talked about, it's there in the reality. I mean, telemonitoring for patients with arrhythmia, it's a 24/7. We can predict when the arrhythmia will come, and we can save people. So it depends on the use of the data. So if it is for saving life, for a better, and even the patients will understand. They know that their healthcare system and the healthcare provider is doing their best to make sure that the patient is safe. We have done it for arrhythmia. We do have 24/7 telemonitoring where we can detect abnormal beats, and at the spot we call the patient and tell them come immediately to save the patients. It was just not even the example. It's not just even in the UAE. Some patients were abroad in UK, and we told them just go to the nearest emergency to get the right treatment. The other things regarding the psychology, there is a great move toward digital mental health, and even we have done like a brainstorming session to see how is the acceptance of digital mental health, chatbots, psychology, teleconsultation, and it was really great. I mean, we have seen it during the COVID. The digital mental health came, the teleconsultation, the rate of teleconsultation during the COVID has, I mean, it was remarkably increased, triple than before. So, and we are moving with digital mental health patients, teleconsultations. Even the youth, they are preferring to have the psychology as teleconsultation rather than coming to a facility. So it is moving toward that. And as you said rightly, I think whatever digital strategy, it should also put it toward the coming millennium. They are more toward digital, toward metaverse, toward virtual reality. And I think even when we do the brainstorming sessions with them, they don't want to come to the physical. I think we'll have less physical facilities in the future. And we piloted the first metaverse clinic in psychology and in family medicine clinic. It was showcased in Arab Health and also in the Innovation Month. And the youth population, they liked it. It's their environment. They wanted to experience the psychology metaverse clinic within EHS services. As I said, I think it's a balance. It's still the data is the patient data. However, whenever you have this conversation with the patient saying, why do you need this data? There'll be a huge acceptance regarding the using of the data for the patient and also for the community, to help the community and improve the overall health.
Definitely. I mean, going back to one of Sajjad's 5 V's, volume, right? What you were able to also collect during COVID-19 data points on individuals across the economy. People were willing to give in their data for the sake of safety. So I do think in terms of an adoption rate for people buying into the healthcare industry, we're almost at 100% if we look at the UAE alone, which is fantastic. I mean, I would love to pass the question to Thea as well on this, because I'm sure you have a lot to add.
Yeah, absolutely. Well, I think some great points have been raised already, and to your point, Dr. Noor, as well. Of course, COVID accelerated this digital adoption in all of our lives. Be it education, healthcare, you name it, everything kind of went online. So there's this massive acceptance that where before there was a lot of resistance, especially with things like teleconsultations. So I think that mind shift happened in everyone, right? In every consumer, be it parents or the younger generations as well. And this is the hybrid world that we all live in and work in now as well, right? So that has been a very interesting shift to see how that resistance and those barriers that were there before have sort of come down. But to your point on data, I think what really needs to happen is conversations between different stakeholders. And I think one of the biggest conversations that really need to happen more collaboratively are between policymakers and regulation, of course, the healthcare clinics and hospital groups and professional providers, as well as insurance, because insurance is a big stakeholder in this ecosystem. So how do we correctly manage this kind of data? What kind of data needs to be communicated, when, how? And I think that's also big questions that patients sit on. I remember when we were also doing this adoption during COVID-19, one of the biggest questions was that stakeholder, which is insurance providers. How much of this teleconsultation or these data points are also being shared with insurance? Can it work against me? There's a lot of fear, right? So I think we need to overcome those barriers. We need to have more collaborative conversations, and we need to have conversations with all the stakeholders in the ecosystem so that we can collaborate towards a better outcome for everyone.
Yeah, and I would actually love to ask Dr. Noor on this point, as Thea is mentioning, because that is definitely a key stakeholder that I would say people are more afraid of than anything, right? So, sometimes people are not willing to even consider a consultation because of insurance. And then they tell each other. Even the other day, I was sitting in the office and a lady told me the price she paid to see a mental health expert, and the audacity that it wasn't covered by her work, by her workplace. But these are the types of questions people are wondering about. If you have anything to comment on this.
Actually, in terms of insurance, we are working closely as all health authorities in not just for mental health insurance, all the healthcare insurance, and how we can go hand by hand in terms of making sure that all governance, guidelines, and policies are reflected within the insurance system. And one of them is the teleconsultation. I know that Abu Dhabi started and Dubai also in some of the areas of medical teleconsultations. However, we are bringing it up again to the ministry to make sure, especially when it comes to mental health, it is there in the Mental Health Act. And we are just waiting for the Mental Health Act to be published soon in the newspaper so we can reflect it, and it will be covered, as you said, as a package within the insurance, the mental health in terms of psychology services or psychiatrist services. So we are working with the ministry to put mental health insurance within the basic coverage of all people. And there is also a digital health strategy, which is also headed by the ministry, and they are looking at different angles in terms of laws, the ICT law, and how to share the information between different entities. Riayati is a big initiative that came out of the ministry, where one database collecting information from all authorities, being private and governmental. And one big factor there is the insurance system and how we can interrelate and how we can also move some of the data that is needed to the insurance and make sure that we are aligned with the insurance system.
Definitely. And actually at Expo, when we had our first panel, they mentioned 800 HOPE, if I'm not mistaken. It's the mental health support line that's been created by the government. So I think there are definitely a few initiatives already rolling out on this topic, which is super exciting as well. Yes.
I have a quick comment to add on that. Couldn't agree more. Everything what Dr. Noor and Thea said about like the whole integration piece, right? Like what happens when policymakers partner with insurance providers, with patients, with hospital operators, because you're getting this like convergence of data, right? And ultimately, the value is created for the patients or the humans, and being able to like interlay between them, because specifically when it comes to financing, if you don't know if your healthcare costs are covered, that can induce like a feedback cycle of stress and making your conversion adverse. So I think it's like a cyclical loop, but patients eventually start seeing the value of it, right? So I think I'm a big believer in sort of like open data protocols where different providers and networks can start sharing data. And I'll give you an example. I'll tell you what's happening in Sweden. So in Sweden, there's a big kind of push around openly sharing data and collaborating across. So there's a push from the top where healthcare data needs to be shared amongst the various providers and everybody gets access to it. But as a result of what has happened is, for example, prescribing painkillers. Every patient gets, and this is using big data, AI, and algorithms to predict the exact dose of painkillers that need to be provided to that patient. So the right optimal dose, so they don't build up resistance, nor are they getting a lower dose. And they can get to this level of detail because data is openly shared. So this is a fantastic example that's worked in Sweden, and we definitely need more open data protocols to be able to improve access to care.
Yeah, definitely. And on that point, actually, I was going to ask you, Sajjad, about veracity, so trustworthiness as well of data. So, we are collecting data from many different sources as well for the patient. How do we filter through that? And, I'd love to hear from actually all of you on this point, because, we might be collecting things that might not be useful for the patient as well. So how do we deal with that?
Would you like me to start?
Yeah, sure. Go.
Okay, so I'll leave it up. I'll try to keep it as short as possible to have everybody's viewpoint. So look, I think technology is moving just so fast that we've got systems in hospitals or other places where some of these systems have been around for 20, 30 years. And the biggest shift in this process in, let's say, the last 12 years is like, today we've got smarter computers with AI and neural networks and supercomputers. We can analyze data way faster than we even imagined, right? And every single day we're making progress. We've got cloud, and every single large cloud provider is setting up in UAE now. So where in the past world, we literally used to have analysts and data scientists who would look through data and manually sort of analyze data. But now you've got really, really smart supercomputers and better algorithms that can analyze and literally find the needle in the haystack. So that's from a veracity perspective. Look, the technology is moving forward, but I think there is a big pain point to be able to take data that currently exists, that we've been historically collecting, cleaning it up, and then structuring it so these supercomputers and algorithms can start using. So I think the healthcare data scientist of the now is really a healthcare data janitorial services before we could start using all of these converging technologies.
No, definitely. I love your commentary on this, Dr. Noor. What do you think?
I agree with Sajjad. I mean, maybe I can say it from the practice now. Actually, we are trying our best to collect all, electronic systems within one data warehouse. We can do this analysis, AI, and bring that later to a meaningful information to our physicians and even healthcare leaders. Because we do have, a lot. We do have the EMR system, for example. It is there for the last 15 years, and it goes longitudinal with the patient since birth until death. So we do have the whole stages, and what is needed now to make sure that this data, these data measures are meaningful for our patient, for our healthcare providers, and for the system to act upon it. And we started actually with several programs where, as I said, for example, performance and clinical excellence program, where we created that one data warehouse to make sure that we are cleaning this data, making sure that it is validated, and later we are projecting these outcomes to our healthcare providers. But it needs a lot of investment. It needs resources and talents. So now we are speaking about AI and how we can predict and how we can put the right tools even before that event's happening. And I can reassure you that the whole country is moving toward that direction, and it is there, and we are aligned also with the AI strategy for the country. As I said even earlier, RIAT is a big initiative. I mean, now our healthcare provider, they can see the medical file in another private or another healthcare authority. This was not happening. It is now evident, and there are certain protocols and certain in terms of diagnosis, medications, even investigation, we can see it. And this even created a whole, what we call it, cost-benefit analysis for the whole healthcare system. There is no need to order the investigation again. I can see the medication, so there will be no side effects in terms of I give another medication that was contradicting with another medication he was taking from another healthcare provider. So alhamdulillah, it is opening now the accessibility of data between healthcare providers, being private or governmental, and having this one data warehouse to start our analysis, our validations, and later how we can bring these meaningful data for our healthcare leaders and providers. This is the next step coming after opening healthcare systems.
No, great. Thank you, Dr. Noor. And I love what do you think, Thea, from your perspective on this? Yeah.
I find it very interesting to Sajjad's point on Sweden and medication. I think there's so much we can also do that is we're just scratching the surface also around like personalization in medication. So I think that's another big trend that we'll see coming, especially with big data, and there's so much more that we can do there. But going back to the points on data points that we're collecting, one is from a treatment analysis perspective. Another is from an optimization perspective. For example, with teleconsultations, we can also track like ratings, reviews, qualitative data on, how are the private or specialists, how are they performing? Because one side is the treatment of patients, but the other side is also the patient experience. So that there's also a lot we can optimize from that perspective as well. And I think that's the one point we haven't touched on yet, but it's very interesting to see how we can also optimize our processes and patient experiences, collecting qualitative data as well as just patient data.
I would love actually to expand on this point with any case study of something you have also gathered or seen in your experience that you can share with us.
I think at the end of the day, it's very interesting to see this qualitative data perspective, because at the end of the day, it is a patient experience. And to your point on the metaverse and making sure the patients have a good experience, it's also gone back to prove that if you have, a good experience, you also have better recovery time and so on, because there's a trust and there's a better connection with your doctor. I think sometimes it's very clinical and we forget that it's a very human experience. It's a very emotional experience, healthcare, right? Because it's a very deep and personal one. So I think just putting the human back in that perspective, this qualitative data on quality of service, are the doctors communicating well? Are you getting the kind of responses you're expecting from your doctor? If we think about any other business vertical, we collect these kind of feedback and we collect this kind of data. In healthcare, it's obviously a little bit different because we're also talking about treating patients, life or death situations, don't get me wrong. But I do think it's important to look at that qualitative aspect as well and to see how we can continuously optimize. We've seen that in certain of our, for example, our CSR projects as well around mental health. We connect volunteers, mental health professional talkers or conversation partners with people who are suffering from different kind of mental health disorders or challenges across Latin America. And they've been able to optimize that service because they're also collecting data points on which conversation partners are doing really, really well. And so then they promote them and more people can connect to them and so on. So just making sure that we're also analyzing that side of the story, I think it's important to mention.
Definitely. Thank you, Thea, for explaining it further. I think that was a big point as well that we heard at one of the first panels at Expo, which was about value, right? So what value are we giving to the customer at the end of the day? Because it's a direct to customer engagement that we're dealing with. And if anything, just knowing that, I think even testing some of the doctors to come on telehealth platforms to get that constant feedback would also strengthen, I would say, their knowledge, but also their awareness of what they're giving to their patients time and time again. So I think definitely utilizing technology as a tool to enable, but also to open, I would say, our eyes to certain things that might be happening over and over again that we're not aware or dealing with. So thanks a lot for that. I mean, on the diagnostic side, and this is something I wanted to ask Sajjad, big data is supposed to be supporting us with diagnostics and also in the end patient care. I mean, from Animal Health's perspective, having run the business for so long or otherwise, what can you share with us?
Oh my God. So in terms of what what we're doing, so I mean, because I'm going to actually step back a little bit, right? So I've been asked this question around, oh, is AI going to replace clinicians, or what's going to happen, or are we going to have like robot doctors and no doctors, right? And my answer to that is no. And I think it links back to all this conversation we've been having. Is the human experience, it's the patient experience. And before I touch upon the diagnostic side, I'm going to link it back to the patient experience side. It's the power of the mind. Because today, when a clinician holds a patient's hands and says, you're going to be okay, they'll use the power of the mind to believe that they're going to be okay, right? So it has a very, very strong ripple effect. So I think, and going to what Thea is doing with her work, it's being able to rate and understand the human emotion aspect of it. We get to better quality care. Now then, coming back to diagnostics and what's happening. So I think the world we're headed toward, it's not going to replace clinicians. We're not going to just have clinicians in the metaverse. We're not. But the clinicians who use these technologies, so the AI-enabled clinician is going to replace the clinician that hasn't used this. Why? Because ultimately it's going down to this, like going back to volume of data that's being generated. Apparently, and I don't know, I've heard this number stat somewhere, we're doubling medical information or healthcare knowledge every 76 days. Every 76 days, medical information is doubling. It's just insane. So from the beginning of time to now, it's just like absolutely doubling every 76 days. So look at the compounding factor. So again, another study was like, to keep up with that pace, it would require a primary care physician, 21 hours of constant reading every single day just to keep up, right? So that's not realistically possible. Like, how do you have clinicians reading 21 hours every single day just to keep up with modern literature, modern research, new therapies, new discoveries coming up? So this is where AI starts helping in diagnostics, right? So you've got so much information coming. You've got patient-reported systems. You've got diagnostics. So at LM Health, we focused on radiology. And our premise was, we wanted to find a digital gateway to healthcare. And for us, radiology was that digital gateway. Because prior to any of the services being digitized, it was radiology that was starting to get digitized because of the large image volumes. You've got, radiologists are the techies amongst doctors, right? So they're analyzing large pools of data and being able to come up with insights. And their insights and reports are elementary to be able to provide care, because based on that, the treatment outcomes are defined in. So now we basically allow radiologists to pull up an image, and then before they've even opened it, we're providing some subtle hints of, here's a lesion, it's already drawn out together, this patient is of certain cluster or category. So over time, we're going to be able to give them better and better insight. The world is study, the conversation we have at LM Health is like, the world is still not ready to have a medical report that says signed robot. It's just not ready. But we still need that clinician to sign off on that. But something that would take, and we've done studies on this, where let's say a report would take 20 minutes to report, we can bring it down to a mere minutes. And that's the power of using big data.
Amazing. Thank you so much, Sajjad. That's super helpful to digest how AI is actually going to be supporting, the amount of research, and perhaps even translating that research across borders. And I think that's really the power of the internet that we're not really taking advantage of just yet. So I think once that's really cracked, we will be able to access research in countries like Korea, for example, where healthcare has already advanced so much, but ironically to say we're waiting for the translation on it, but no, truly, but we are accessing information at different times. So eventually we would make the world a smaller place. Thea, what would you like to comment on this point as well, related to diagnostics for
I think there's a lot around machine learning and AI that we're talking about that are repetitive tasks. So I totally agree with this point in terms of, what can we take out of the professionals' hands that can be automatized or analyzed at a mass scale. There's many data points around this, and I'm sure you have other data points to mention here too. But for example, going back to mental health, there's a lot of sentiment analysis, even in the way that people speak, that can be diagnosed with depression or anxiety or other disorders with around an 80 to 90% accuracy. So there's a lot that we can also use to analyze or to help confirm an analysis potentially as well. So I think there's a lot that we can take out of a physician or an expert's hands and make sure that they have the right kind of backup to either back up a diagnosis or verify something. And it will save them a lot of time so that they can really focus on what they do best. And I think that's essentially what technology is doing. How can we optimize things so that you can focus on where you're really creating and adding value? Because to your point, maybe sometimes just hearing a doctor say and holding your hand and saying, you will be okay, we'll get through this. That power of just saying that statement is something a robot can never do for you, right? And also making sure that a person has analyzed this information, confirms this information, and then tells you, okay, you will be okay. I think there's a power to that human connection that we really simply cannot replace. So really making sure that we're focusing people's time on where they're creating value and making sure we use technology to optimize their time, to analyze these kind of data points and to confirm things or to accelerate research. That's where I think we're going to see a lot of change. And going back again to this point on personalization of, medication, again, there's going to be a lot of data around that as well that can be further optimized too. So I think that's a very interesting space, this personalization around medication, that I think we're, again, just scratching the surface on, but I'm really excited to see what will be happening in that space.
Definitely. Thank you, Thea. And I'd love to move our discussion into health informatics, since this is also something we would love to get to today. I'd love to start with Dr. Noor regarding public health information. What are going to be the true benefits, maybe not just to Emirates Health Services, but to the wider economy as well?
Okay, and I'll just have one comment regarding AI and diagnostic, because we are also using some of these AI digital tools. I think it improved the efficiency of and the utilization of the service in terms of having more numbers. For example, we are using AI to detect breast cancer pathologies within the CT scans. So this, even from a physician's feedback, it helped them to improve the efficiency, the diagnostic accuracy. However, still our physicians are there to take the diagnosis and, as you said, and to have that experience with the patients and have that counseling after, and how to also to give that information. So AI helped us, especially in diagnosing, in improving our efficiencies and having more time for our physicians and healthcare providers to stay with the patients, because there are certain tasks where AI has been put in place to improve the efficiency of the whole services. In terms of health informatics and public health, actually, within Riayati, and it is our big HIE platform here in United Arab Emirates, and we are really proud to have it go live in 2021. And as I said earlier, it combines all healthcare systems and providers together in one database. And the use of database, I mean, you name it, it's for public health initiatives. It's to serve a country vision in terms of improving our healthcare system, cost effectiveness, and how we can reduce cost and improve efficiency of the services, our surveillance, and even the COVID response strategy, how we can monitor infectious disease surveillance across the country. Because as you said, as you know earlier, it was 3 main healthcare providers, Dubai DHA, and there we have Abu Dhabi Sahha, and in the Northern Emirates, it's EHS, and the ministry coming at the governance level. However, having this one platform, it gives us, a big window for public health initiatives when it comes to surveillance, when it comes to public health programs, prevention programs, because now we can see the whole data where is the population, where are the prevalence of diseases in diabetes, chronic disease management, cardiovascular, and based on that, you can put your programs.
Very interesting. And I'd love to also ask Sajjad the same question. So, you have been working across the Gulf on big initiatives, also supporting the government. So I'd love to know from your perspective, you don't need to name any names that.
Sure. Yeah, obviously kind of like look at, because, given how data is kind of getting aggregated, right? So there's been incredible strides by public health professionals. And I think, my respect and love goes to all the loved ones lost in COVID. But as a health tech, enthusiast, health tech has really healthcare has skipped a decade as a result of that. So the amount of data that has been collected at the public health level and being able to aggregate, and the amount of visibility that we have, our incredible leaders are going to already making changes, and we're going to increasingly be able to see more changes, that the people will start seeing the value. So now at the public health level, and just in the last year and a half or so, what I've been able to see, data is coming from all over the place. And now this can be used to enable leaders and decision makers to see what you do with it. But it's coming at a very, very granular level. So, I actually got to work with some critical ICU data, where we're seeing, let's say, what clinical condition they were referred to for before getting into the ICU, occupancy, how long they stayed. So every single bed actually has a sensor on it. All of the equipment that has a sensor on it. So we know exactly which equipment is working, which is not. How much time they spent under the bed and what they didn't, how long they haven't. Same thing, EMR records are coming. So as a result, we've been able to build predictive algorithms and dashboards to be able to say, you know what, in the next weeks, you need, as a country, as a nation, you're going to have this much occupancy. Certain conditions, we're seeing kind of like chatters of information that are coming that'll enable this much average length of stay, which is a big indicator in hospital, because the more you know about your length of stay of your individual patients and you add them up, you'll be able to, let's say, mobilize your resources effectively. How many ventilators are working versus not? How many ventilators should we be ordering? So all of this adds up to it. So then there's this information on the public domain. But on the same data set, we're also superimposing what people are saying, which is sentiment analysis, information, tweets. I'll give you an example of a company in Toronto that we've been looking into. They were a group of people. They were actually just academics, researchers. And because of the work what they've been able to do, they've evolved themselves into a company. It's a company called Blue Dot. So they used Twitter reported data on people's flu-like symptoms off of Twitter coming out of China to be able to predict pandemic markers before anybody else in the world, right? Because they actually took in data. So I think what's been happening now is we're seeing extreme amount of, let's say, granular data, like bed sensor data paired with public domain data. When you combine them together, you find some really, really useful, drivers.
Yeah, great. No, thank you so much for sharing that. I think it's interesting to just see how it affects the entire economy. I mean, if we look at going back into big data for a second, right? Just knowledge being power. About $21 billion was wasted. I heard from one of the stats in 2018 on the wrong prescriptions being given to patients. So it's incredible to see how, by just consolidating information, offering it to the patients in the right way can save lives and save a lot, of capital expenses on government entities and healthcare and hospitals as well. So this is very interesting as well to look at. Does anybody else have any comments on what Sajjad had mentioned? No? All right. I will actually open the floor for any questions in case anybody has anything to share with us. We'll just wait a minute or two to see if anybody has anything to mention. I have a shy audience. But anybody else like to add any other points on health informatics in general? I mean, it would be also interesting to know anything else related to the case study that you had mentioned earlier, Dr. Noor. Is this for PACE? Is that related as well to health informatics?
Yes, so we do have the Performance and Clinical Excellence Program, and as I said earlier, it is an evaluation system for the healthcare services within Emirates Health Services. The program started in 2013, where we looked at operational data for the hospitals, looking at the whole patient journey and we do have certain clinical and operational outcomes that we monitor the whole services in the emergency, in the inpatient area, outpatient, the surgery utilization, the critical care service, and the utilization. So that was at 2013. In 2015, we wanted to create one data warehouse for the clinical systems that we are using. So being, for example, the queuing system, the coding system, the insurance system, the EMR, it's all feeding into one data warehouse, and later we can project our outcome measures within the dashboard. And this has happened, alhamdulillah, in 2015, and it was also announced in the Arab Health. Later, we moved to live dashboards. So at that moment, we want to see what is happening in that hospital, in that emergency department. Is there any deviation than the targets, waiting times, heat trends? And we were successfully able to launch these dashboards in 2017. So we have live dashboards on inpatient services, on emergency, and even on outpatients. So we can see live what is happening there. And now we are moving more toward the clinical outcome measures. So we have created PACE for Quality Outcome Program. And we are looking now on chronic disease management. So, and benchmark our service with the international organizations. For example, we took as a reference ICHOM, a database for diabetes and for chronic disease management. And specifically for this program, we are looking on different measures. For example, if I take diabetes as a case study, so we are looking at diabetes control at the patient level, at the service provider level, what is happening there. Then acute events for our patients, chronic complications, patient satisfaction through the whole journey, and the service utilization with also financial measures for the whole journey. So with that, I can see the whole picture: clinical, operational, financial, and with the patient element. And it goes to the patient level. And that was unique actually for EHS. And also it was just announced in the Arab Health, being the first health authority that produce a full diabetes clinical outcome program, looking at all areas concerning diabetes in at different level of care, in primary care and hospitals. And based on that, later, as I said, we can monitor services, we can improve the patient outcomes, and go even these data, as you said, and it will go to the patient, so we can tell the patient. And this is where we can see the monitoring and now the telemonitoring, and how our physicians are interacting with the patient and putting a personalized care plan based on these outcome measures. So I can see in one facility what is happening, and later I can do personalized care plan for our patients.
Very interesting. Thank you so much, Dr. Noor, for sharing the case study. It's interesting. If we wanted to look it up online, would we be able to find information on the PACE case study? I'm not sure if we can. In any case, we'll look for it. But it's great to understand a little bit more on the predictive modeling, and also, what health informatics can really offer to the entire industry, for the sake of prevention, and to be able to support our patients better and to offer them the best value. So with that, I don't have any more questions for the panel. I was hoping we'd have a little bit more of a chatty audience, but I guess maybe not for today. In any case, it was a wonderful panel. Thank you so much for sharing so much great information about what's happening, what should be happening more. On Thea's point, for example, on really testing more of our doctors, really trying to understand how we can serve patients better, and looking at what still needs to improve. Thank you, Sajjad, for also mentioning the infrastructure development that maybe the UAE has a very strong foothold in the healthcare industry, but other Gulf countries can definitely advance to support their patients better. I think we have, okay. Dr. Noor cannot hear me. I'm not sure why. Thea and Sajjad, are you able to?
Yeah, we can hear you very clearly.
Yeah. Okay. Sorry, sometimes this happens online. But in any case, I just wanted to say thank you to everybody who joined us on the call today, and we hope you really benefited from the conversation. And if you guys have any more questions, please feel free to tweet at us at Bold Consultancy, and we can ask our fellow panelists if they can get back to you on any questions. Great. And with that, thank you so much, and we wish you all a very, very nice day. Thank you for joining us.
Thank you so much.
Thank you. Thanks.
Thank you. Thank you.
Bye bye.